Good morning, ladies and gentlemen. My name is JuanMoncayo, and I'm going to show you how to do Hadaka Jime. In other words, how to do a rear naked choke. But before that, we're going to go over some history or some basics about the rear naked choke. It's called the Hadaka Jime because it originated in Japan as a part of the martial arts known as Jiu-Jitsu and Judo. Now that we know some history about it, we're going to go over some safety issues. Before practicing this, you need to be aware that it is a very dangerous technique and can leave long-lasting effects if not applied correctly. So, there are two main safety rules before practicing. Number one is cooperation. Why do I say it's cooperation? Because whenever you practice a choke or any other type of submissions, you work with partners. Now, it is very important for the guy who's performing the choke to be very careful and to practice it slowly rather than doing it fast and trying to pull someone's head off. It's better to practice slowly. And the guy who's being choked, he needs to get to a point and realize the point, his limit, if we could call it that. But the point when it starts hurting, so he can go to the second part, which is the tap. Tapping is basically doing this, and if you have ever seen the UFC fights or any other type of fight, they usually tap out when they submit or they surrender to their opponent. However, whenever you're in practice, it is very important to tap out as soon as you feel any pain, so that you do not get damaged or any lasting effects. Now, how does the choke work? Its objective, it's simple. It's to submit your opponent without causing further damage or wasting a lot of energy like most other martial arts do, like kickboxing or Muay Thai. However, the function is very different. In a normal choke, you would try to cut out the air. In this choke, you're not trying to cut out the air supply. You're trying to cut out the blood supply from both our arteries, the carotid and the, I can't remember the other name, but your two main arteries that run on each side of your neck. You're using your bicep and your forearm to block the blood supply. That's why it's a very dangerous technique. If held for longer than 20 seconds, the victim or the person will usually fall unconscious, and if held for more than 40 seconds, you will cause brain damage. Now, I've narrowed this down into 4 simple steps, and I need a volunteer for the choke. If anyone wants to volunteer? No? You sure? Okay. Thank you, so you can take a seat. And the choke is actually very simple. Number one is position. Now, the position of the choke is usually going to be in a V, like that, like if you were flexing. So it's usually like that, so you can put your bicep under one artery and your forearm in the other one. So the position is really going to be like this. Now, it is very important. The elbow needs to be aligned with the chin. So I'm going to take my jacket off so you can actually see my elbow. And also, this is very awkward for the person who's being choked. So, the elbow needs to be aligned with the chin. It cannot be like this, it cannot be farther down, because otherwise you're just cutting off air supply and you're not cutting off the blood supply, which needs to happen. So once you get the position correct, the next thing is the grip. If I hold it like this, try to pull my arm up, the other one. It's fairly simple for her to get free from the choke. No matter how hard I try to grip, it's simple. The correct grip is grabbing your bicep and then closing your other arm. This way, if she tries to pull it, it's in a lock and she can't. Now, once you get those two down, the next thing is something I like to call the cross. It's not really called the cross, but it's the easiest way to remember that you just need to put your arm that's behind her head and cross it under her neck. And then you're going to grab your other arm. Now, once you get the position correct, you're just going to hug. Tap out when you're ready. Okay, so you see, I'm not trying to pull it and really flex my arm and try to cut off all supply. No, what I'm just simply doing is I'm simply getting close and I'm doing this movement, pulling my shoulder blades back and just breathing in, because you're just giving the hug. So we're gonna go over it again so that you now know how to do a rear naked choke. Number one, position, the position, elbow aligned with chin. Number two, the grip, correct grip and cross. Then you cross over, and you just get close and hug. And that's it. Thank you very much for early on. Those are our sources.